My name is Shelby Hubbard, and I work at Louisiana Urology, and I was invited here today to talk to you all about urodynamics. Urodynamics is a dynamic study of the transport, storage, and evacuation of urine by the urinary tract system. It is comprised of a number of tests that individually or collectively can be used to gain information about the lower urinary tract system. Urodynamics can be a valuable tool in the evaluation of urinary storage and voiding dysfunction. Urodynamics tests help the physician to see how well your bladder and sphincter muscles, urethra, are storing and releasing urine. It also provides the necessary information to diagnose and treat the patient accordingly. The purpose of the urodynamics is to provide objective confirmation of the pathology that a patient's symptoms would suggest. Urodynamics testing is done when history and physical examination, simple tests are not sufficient to make an accurate diagnosis or institute any treatments for the patient. Urodynamics tests can also show whether the bladder is having any involuntary contractions that cause urine leakage. This test may be recommended if symptoms suggest problems with the lower urinary tract system, like incontinence, prolapsed bladder, urinary retention, recurrent UTIs, incomplete emptying, enlarged prostate, and patients with neurological disease. Some of the tests that are included to do the urodynamics is the uroflow, the post-void residual, the cystometric test, leak point pressures, pressure flow study, electromyography, and some video urodynamics. The uroflow of the test basically measures the urine and the speed in the volume. The post-void residual is the residual that you get after the initial flow for the test, and is usually done with the catheter. The cystometric test, it measures how much urine is in the bladder, how much it can hold, how much pressure builds up inside the bladder as it stores the urine, and how full it is when the urge to urinate begins. And we also insert a catheter into the bladder and one also into the rectum to measure these points of the test. The leak point pressure, it measures the point of leakage during the test. So you may have the patient to cough or push down just to see if they're leaking their bladder is full. The pressure flow study measures the bladder pressure required to urinate and the flow rate given pressure that it generates. The electromyography are two little stickers that are stuck by the bottom of the rectum of the patient, and it measures the electrical activity of the muscles and the nerves in and around the bladder and the sphincters. Then you also have the video urodynamics. It takes pictures and videos of the bladder during the filling and the emptying part of the voiding phase. The equipment that may be used is an X-ray machine and it's fluoroscopy. And with the fluoroscopy, there is contrast dye that's inserted into the bladder so that the bladder can show up on the X-ray machine. This is an example of what the patient will look like once the catheters are inserted and the patient is actually hooked up to the machine. And this is the whole setup. You have the fluid here that's going to be going into the bladder, and these are the wires that are connected to the patient so we can get the results on the screen. And next we have, this is an actual urodynamic study that was done on a patient. This first line here, it actually measures the volume. This red line here is called a detrusor, and it measures the two numbers that we get from the two catheters in the bladder. The blue line, it actually measures the pressure inside the bladder, and the pink line measures the pressure inside the rectum. And this yellow line is actually measured when the patient voids. And we already talked about the video urodynamics. And this is an actual urodynamic study with the video on the side. So if the patient coughs or push down, you can actually video it at the same time that they're doing it. So just in case they have any leakage or anything, the video would catch it if you didn't see it. And this is the setup for the video. This is called the C-arm, and this is the monitor back here, so you can actually see what's going on when you're x-raying the patient. And what happens after the test? The patient may feel a little burning after the test just because the catheters have been in for a little while. They normally come back in about a couple of weeks to see the physician, and they'll go over the results of the test with them. And if they have a history of any UTIs, then we normally give them an antibiotic just to prevent them from getting an infection from the test. Anybody have any questions? No questions? And again, my name is Shelby Hubbard, and I'd like to thank you all for inviting me to do this presentation.